Um, for folks who might not be familiar with the Reproductive Freedom Alliance, do you want to say a couple of words about what it is and what you all do and the kind of work that you're doing right now?
Sure. Thank you. Well, one, thank you so much, Jessica, for having me on your live stream. We were just sort of saying that, like, I am such a fan of the work and such a and like read your column every single day. So, it's such an important time, and I'm really excited to be able to talk with you more about the work. So, the Reproductive Freedom Alliance is a nonpartisan coalition of right now 23 governors across the country who have come together to work and to work together to protect and expand reproductive health rights in their states. It was launched in early 2023 in direct response to Dobbs, when states realized, like, yeah, governors in particular realized they are on the front lines of protecting access. And they needed to have a space to be able to work across state lines, to be able to collaborate with each other, coordinate on strategies, and share best practices and learnings, because they were all trying to figure this out on their own. Um, and what we've been able to do then is be able to have this platform with which they and their teams can come together and really be able to share these learnings so that it can accelerate policy changes at the state level, and then also think about how they can collectively use their voice. I mean, these are
Mm,
governors across 23 states. They represent over half of the U.S. population, command a sizable part of the economy. I mean, they have a massive, remit and
mm,
responsibility, and I think a platform to be able to make real change and demand real change. As
yeah,
their governors of their own state, but then across the country.
yeah.
And so this is just, we can talk a little bit about some of the examples, but, like, they have come together in 2023 to, work on stockpiling medications when the AHM case was there and was threatening
Yeah.
mifepristone, and making sure that there was going to be continued supply and access in their states. They came together to stand up shield laws as quickly as they could in response to Dobbs, and to try to protect patients, providers, and
Hmm.
in those states, right? So now 20 of the 23 states have shield laws. They've thought about ways of protecting contraceptive access, reducing healthcare.
Mm,
So it's all of those different things that, like, a great idea comes out of New Mexico, and you're able to spread it around to 23 other governors
right.
to think about how they might be able to implement that in their states.
Right. And most of the governors are representing states that are pro-choice, but there are a few, right, that aren't. I know there's Kentucky, right, and Wisconsin, like abortion is sort of up in the air. Like what does that look like for them, when they're trying to do this work with the other
Yeah,
governors?
it's true. We're not sort of like, I think that folks will think about these as like a deep blue, like, monolith, but it's not. I mean, I think these 23 states definitely have, like, that very progressive element that's there, where you do have
Hmm.
alignment in, the governor's office and state legislators and the AGs. And, they can do a lot. We have a
Yeah.
lot other states that may not have that same kind of political landscape. And so, like a Kentucky or a North Carolina,
Hmm.
or Arizona,
Yeah.
Wisconsin, Pennsylvania, now Michigan. And I think that
Yeah.
I think that their tools are different, right? I mean, so
Yeah.
I they're going to be relying on, and the governors have a lot of tools at their disposal. They can do
Mm,
executive actions. They can direct state agencies like health and insurance. They can sign laws. They have control over like, big control over their budget. They have a bully pulpit that they can use and get out, right,
mhm.
good information. And so so I think that governors, regardless of the state that they have and the political landscape that they're navigating, have all of those tools at their disposal. In those states where they may not always have that legislature, like, with them, and they
Mm,
pass the laws, I think they're leaning really heavily on sort of executive actions, executive
right.
orders, working through things that they regulate, and through the state agencies that they direct.
Right. Can you give an example of like an executive action that because I feel like they're on the national level, and like if you're not in that state, I don't know that people are necessarily paying attention to some of those things, and so I think it would be useful for folks to understand.
Yeah, for sure. So, I'll take the shield laws as an example. So,
Yeah.
most direct way to do that, right, is to do an executive is to pass legislation. In places where you may not be able to get that, such as in North Carolina, they
Mhm.
through executive order, and so there they said that they they made sure that and they made it clear that that they were no state employee was going to they were prohibited from cooperating with any
Right.
state investigation, right? They weren't supposed to give away
Mhm.
data and work there, so that they were really being able and lend a hand to sort of the, this overreach from hostile states. So that's one example of what they've been able to do.
Mhm.
And in Arizona, Governor Hobbs had was thinking about how she could expand contraceptive access, and so
Mhm.
looked at sort of state regulated plans or state
Mm.
employee plans and said like, okay, I'm governor, I have control over like the health plans of state employees, so we are going
Mm.
to make this coverage available for our state employees, and we'll and use that as a model then to be thinking about how we can expand it to other populations that are covered under different health plans. So there's
Right.
lots of different ways that they can sort of think about, how they can get these things moving. Governor Shapiro used not an executive order, but really just like the power of like, I think of the bully pulpit around
Yeah.
OPIL and
Mm.
brought, basically just asked the question of every health plan, like, we've got this new like over the counter contraceptive. Are you covering it? Yes or no? If you're not,
Yeah.
tell us why, right? And
Right.
just by asking that question, it's prompted and ended up having two of
Yeah.
their biggest providers saying, "Oh yeah, we're going to cover it. We will cover that." And they're like, "That's great." They put out a bulletin to all of the health plans and said, "We just want to lift up these great examples about how of these health plans," and without doing
Right.
any regulation or any requirements or mandates at um, all of the other plans like later on followed suit, and so now
Right.
there is coverage for over the counter uh, contraceptives. So there's lots of different ways I think that governors can
Yeah.
be creative about using their executive power
Mhm.
to advance policy priorities.
Yeah. Can you talk a little bit more about the stockpiling of abortion medication? Because I know this is something that like people generally know about, but maybe like who's doing it, why it's so important. I'm certainly always like banging the drum on trying to get people to to get advanced provision for themselves, but obviously we love to see states doing it on a mass level.
Yeah.
So I would just love to hear more about it.
Yeah, I mean, I think that with the AHM case that I referred to,
Mm.
there were a coalition a subset of states that came
Yeah.
together and stockpile 350,000 doses nationwide across their state.
Oh.
They were
Yeah.
able to think about like how they could help to like negotiate together with a common contract and like and
Mm.
basically like compete with each other.
Yeah.
So and I think they are like continuing to look at that as one tool to try to maintain, adequate supply. But stockpiling is just one contingency tool. I think we need to layer it.
Yeah.
It's like you need to be able to pair it with, increased access to telehealth, right?
Yeah.
And like include it with sort of looking at reimbursement rates for providers, so that they're able to have a sustainable stream of funding. So all of those things
Mhm.
play into that. And I think that stockpiling is not an option for every single state. There are still like legal and regulatory requirements that put restrictions on what state funds could support,
Yeah.
and so it's not something that every state can do, but it's definitely in like the toolkit for what states.
Right. Right. I know there's only like so much that you can say about certain things, but obviously like mifepristone access is on everyone's mind and like this
Mhm.
new bullshit study that has come out. Um what do you think? Is there a plan, or like how much can you share about what sort of pro-choice governors are thinking about in terms of what happens should the FDA roll back something like telehealth access, right? And you have this obviously you have the stockpile there, so you don't need the telehealth access necessarily, but are there plans for sort of those contingency plans for what happens should the FDA go back to those pre, 2016 rules, where, you have to use abortion medication earlier, where a doctor has to be present? How much conversation is sort of happening around that?
I think that, because medication abortion is the most common way that people are getting,
Hmm.
in the United States, accounting for like almost two-thirds of abortions, clearly something I think that we see as in the crosshairs of, the opposition. And so, yeah, we've been doing a lot of planning and thinking around contingencies about like rollbacks to earlier regulations around how mifepristone can be prescribed and dispensed. And so I think, thinking about some of it is sort of thinking about how we might consider different protocols for abortion medication, right? It doesn't,
Hmm.
we know that there is evidence for, about a MISO only protocol, for example.
Right.
So really, thinking about like how that might be rolled out, right? I think we can be thinking about, there in 2016, you still had some types of telehealth that was allowed, like site to site.
Hmm.
There are ways for us to be thinking about that. I think they're looking at if we need to have more brick and mortar sites, what
Yeah.
are there regulations that are like that present barriers for providers to
Hmm.
be able to expand their hours or expand their sites? Are there things that we
Right.
rolling back and still protecting patient safety, but making it easier
Right.
for more in-person sites for that to happen. So I
Right.
think um, I think there's a lot of different, and I think so part of this is also just sort of thinking about what the landscape looks like within each state, and
Mm.
what's possible, and then sort of them being able to kind of put together a plan that's gonna make sense and that to roll out in each of these different states.
Right. I mean, what's so interesting is like it feels like a lot of the work that you all are doing, which is so amazing, is very preemptive and proactive, right? And you're thinking ahead. But I also don't want to give folks the impression that like pro-choice states are doing just fine because they're not, right? Pro-choice states are really taking on this huge burden of this influx of out-of-state patients. And providers are incredibly overwhelmed, and the system is just incredibly overwhelmed. And I know that some states are doing things like trying to increase who can provide an abortion, right? And like expanding it beyond physicians to nurse practitioners or physician's
Yep.
assistants. And so I'm wondering if you can talk a little bit about that and how you all are thinking about expanding the provider pool, right? Just to deal with that sort of inundation of out of state patients.
Yeah, I mean, it's such a great question. It's something that's so important to think about because it's not just what is like it's not just what's happening within these haven states, right? These
Right.
states, but it's for like the hundreds of it's the thousands of people who are coming and seeking care in these states, right? I mean, Guttmacher just released some data that showed over 150,000 people were traveling to other states for care,
Yeah.
right? The vast majority, they're going to Illinois, North Carolina, they're going to New Mexico, you know,
Yeah.
uh, and it's like 35,000 to Illinois, it's 12,000 to New Mexico, and in New Mexico, that makes up like out of state patients makes up almost 70% of the abortions that are being provided in their states, right?
You
So
say
like
70, 70?
69%, just looking this up, of the abortions that are provided in the state of New Mexico are provided to out of state patients, right? So there,
That's wild.
it's
That's a
wild.
wild
It's a
number.
wild number. I double checked it. I was like, is that really?
Wow.
But it is. It is because they're so desperate. Similarly to Kansas. Kansas is similarly situated, and it's something like 70% of the patients that they serve are
Wow.
not, right? They come from out of state because they are seeking care that they can't get at home, and it does put tremendous strain on these surge states, right? I mean,
Yeah.
and also because it has to be like you want to deliver it in a timely way. This is time sensitive care. You can't delay it, and so how do you sort of keep up with that? So a lot of them are sort of what they call expanding scope of practice, right? So
Right.
think about nurse practitioners, licensed midwives, physician assistants, right? Like
Mhm.
are these are all providers who could be trained to do this? Um, you know, Leaning on family medicine doctors and primary care,
Yeah.
putting that as part of like their training and bringing that work and expanding that workforce. States
Mhm.
invested in provider training They
Mhm.
like loan repayment programs and things like to be able to offset their training and train
Right.
more people in there. I think it's about sort of like increasing access to telehealth,
Mhm.
and so that you're able to, so like if it's a pretty straightforward early, like most abortions, pretty early, and along the way, people are
Mhm.
able to do that in a way that, like, you can deliver that care in a safe,
Right.
efficient, effective way through telehealth, and to be able to preserve some of those other like in-person, procedures for folks who might have more complications, right, and might need to have like
Right.
a higher level of care. And so that's another way, I think, to be able to kind of meet up with that demand. And so, I think that they're kind of looking at, and then states are investing a lot of money into that
Mhm.
infrastructure too, right? So, for that training and that capacity, and really seeing, and I think they're continuing to like look for that, right? Like, how do we
Right.
partner with, with medical schools and resident training programs, and like develop this pipeline? So it's an ongoing effort that's happening.
Right. Has there been a backlash against that specifically? I mean, I guess of any of it, but like from anti-abortion states, like what has the response been to all of this work that you all are doing, whether it's like the stockpiling or the, training more providers? I know I forget where it was. I want to say in Washington, like Idaho stopped some long-standing relationship with a Washington hospital where they would like trade medical students because they're like, "Fuck
Mm.
you, you guys train in abortion, so we don't want our students going there." And so I'm just curious, like, what are the like interstate beefs that are happening over these things?
That's so interesting. I have not heard about that, like, Washington, Idaho
Yeah,
dynamic.
yeah, yeah,
I think that, like, what I hear from the governors and their teams, is that they're actually really worried about, like, the residents, the new doctors that are coming into their states who are trained
yeah,
in states that
mhm,
don't receive this training, right? So, like, now you have like OBGYNs that are coming from Texas, and they
yeah,
have the opportunity to, to be trained on their full, like, for the full scope of the work that they're needed to do, right? And so now they're
right,
thinking, how do we, so if they're coming into New Jersey, how do they supplement that, right, so that they can actually be able to deal with the influx, and for what the patient needs in front of them, right? So I've actually heard it
right,
more the other way around. um,
really,
yeah. It's like that, becomes, and sort of, and as part of like the workforce, conversation.
right,
So, but I thought where you were going with that was
yeah,
actually, is actually sort of like the tests that we now see around the shield laws, right? And so,
hmm,
and like, and the reach, like now we see, for the very first time, both Texas and Louisiana reaching to, and trying to prosecute, a New York provider, right? And so
yeah,
that is for me where I'm sort of seeing, like, I think that's sort of the next frontier of where, of what we're sort of seeing, happening, and pointing to where there might be some gaps that we think we need to, to strengthen within our shield laws. And so I think part of the, we sort of we're looking back on that and seeing, like, part of the reason why this provider might have been identified was because her name
mhm,
was on the prescription label, right? And so
yes.
York really quickly moved into, and passed a law to say that we can take that provider's name off of that prescription label. And then I think what happened within the alliance is that, like, other states are like, you know what, that can happen from in my state too. Colorado
Yeah.
just signed it. It's being debate. It's being discussed now in California and in Maine. So this is exactly, I think, something that, we're sort of seeing as sort of the next frontier.
Right. I want to talk about that for a second. For folks who don't know, and I'm gonna send out like a short column about this later. So I think a lot of people watching and who will watch know that Dr. Maggie Carpenter, who's an abortion provider in New York, was targeted with a civil suit from the Texas Attorney General. Was targeted with an indictment in Louisiana, and now today they've the attorney general in Louisiana, it's come out, is investigating a second case, and they're just like really really hot to trot to extradite her. And even though New York's governor has made very clear, like, I think her quote was "no way in hell," like that is not that's not happening. um they're really hot on it, and it seems like they're preparing for a case that's going to go all the way to the Supreme Court. Like, it seemed to me when I wrote about this that they had this sort of like coalition of Republican and anti-abortion governors had picked their case very carefully. They picked this first post-Roe criminalization case very carefully, where they were looking for someone who might be seen as unsympathetic. And I'm not talking about Dr. Carpenter. I'm talking about the mother of the teenage patient who was also charged in Louisiana, because they really want to talk about how this is not about abortion, this is about coercion, right? Because they know that abortion is so popular that like anything that they can do to make this not about abortion but get the issue through the courts, they want to do. And it's just such an insane idea to me that we're having this like interstate battle where they're trying to extradite a healthcare provider. Like I almost feel like sometimes we're not like getting back to the basics of that. Like when this is being covered in the media and when we're having these conversations, it's
Mhm.
like they're trying to take the people who are saving women's lives and they're trying to get them out of their state and put them in jail. That is such a wild and reprehensible thing. And I just, I mean, and I'm so glad that, thank goodness, that we have these shield laws, and thank goodness that some states are starting to, take providers' names off of pill bottles, because this is how they identified Dr. Carpenter both in Texas and in Louisiana. Um, and so that was sort of my rant about it. But what what can people do, sort of on an individual level, to is there anything that they can do to sort of help support that effort, the shield law, protections, that effort? Is there anything that they can do to throw support to their governors or throw support to their state leaders and make sure that they know how important these protections are? Um, I don't know. I want to talk more about it.
Yeah, I mean, I think individually, I mean, it really depends on like, I think your approach. I mean, I think showing support to our leaders who are standing up to
Mhm.
this, I think is really important. We need to signal to them like you're doing the right thing, you're representing us
Yeah.
and you, and and because this fight is really tough, right? And so and continue doing that, right? Like you want to like be able to sort of, I think, have them hear that signal that this is the right thing to do. Um,
Yeah.
I also think that like, if you're a provider, right? I mean, I think that raising your voice and sort of saying like,
Mm,
we're just doing our jobs. This is what we were trained to do. This is what we're dedicated, what we've committed ourselves and our time and energy and education to do. It's to deliver care to people who need it, right? And so,
mhm.
and we're delivering it. It's legal care. It's life saving. It's life
Yeah.
changing, and just let us practice, right? Like we are
Yeah.
all governed by our own medical boards and our own professional associations. Just let us do our jobs, right? And get it.
Yeah.
And I think that's part of it. I think helping, I think, gosh, sending support to our providers and letting them know
Mm,
that they're, that we understand how important that
yeah.
is mental, thinking about how to support providers in and patients who are seeking that care. So
Mm,
a lot of our, I think so, and just knowing that that is out there, I think is another way. It's hard to think about. Yeah, so I think those are
it's
some
yeah.
mind um, that come
I
to mind.
want to No, that's great. And I think also, like, when we we'll shift to questions in a few minutes, but I know that I could already see like a couple of questions coming in about taking names off of prescription pill bottles, and what folks can do to support that effort. I think in California specifically, there were a couple of questions. But I wanted to know, is there anything, obviously, something that I've been tracking at the newsletter is sort of the proliferation of crisis pregnancy centers and the funding for crisis pregnancy centers. And it's really clear that this is something that Republicans they already were putting so much money into them, but they're like really, really um, doubling, tripling, quadrupling down on these fake clinics, both in terms of funding, but also in terms of sort of their enforcement arm for just this awfulness state to state. And I know some states are working to try to stop them from spreading misinformation and disinformation, but is there anything else that's going on with CPCs that folks should know about?
They're really hard, right? Because I think that you're thinking like a lot of the things that come up, like I think get challenged around like First Amendment and right to free
Yes.
what they're saying are a bunch of lies, right? And misleading for people. But one thing that actually came to mind that I thought was really interesting and would love to sort of see taken up in other states is California passed a law that said that only licensed medical providers are able to use ultrasounds. Um,
Mm,
and with that, I think we're
interesting.
taking away a really important sort of like appeal and tool that CPCs use to draw people in, right? And so I think that and that becomes like an indicator to say like, no, maybe that's not, this may not be the place I thought it was, right? I mean, a lot of
Yeah.
times pose as medical providers, and people like unwittingly go into into
Yeah.
those centers without really knowing like what they're walking into. And so this is a way to be able to signal that. And the California AG has actually used it to prosecute, right? So they're using it.
Mm,
And so that's an interesting tool. I wonder, like, if that could play out in some in other places, and for consideration. I think you can also sometimes I think you can there's ways of just making it harder for that, like reporting requirements if they're getting funding from
yep.
state, thinking about like the reporting that they have to do, creating things in their contracts that like make it harder for them to be able to access the funds, or directing it to be able to be used in things that are going to be much more that's going to be science based, it's going to be data based, and not some of these this misinformation
Yeah.
spreading around. um, I think those are some of the I think some things that are quite interesting that we're
Yeah.
and sort of and thinking about as well.
I mean, I love the idea of only like a licensed medical professional can do an ultrasound. That I feel like that does, I don't know what the politics are there with like ultrasound technicians and like what that
Right.
all looks like, but it does seem like part of what needs to happen is just like this making very clear that this is not a medical clinic, and like also changing the regulations, because so many of these people I know, like the way that they get around a lot of these regulations around calling themselves a healthcare clinic or a medical clinic is that they'll have like one doctor who's the medical director of like
Right.
7 CPCs, who comes in twice a year, right, and says I'm the medical director, and meanwhile like there's no actual medical professionals on staff at all. And then also the HIPAA stuff, right? Like, and this is something I've written about before that I just continue to think is just so completely unbelievable, that so many of these fake clinics, these centers, will either say explicitly or give clients the impression that that their data and their private health information is protected by HIPAA when it is absolutely not protected by
Right.
HIPAA. And it seems to me like they must be breaking the law, like some consumer protection law or some health data privacy law, right?
Right.
Um,
Right. I mean, this is actually something I think we are really turning our attention to, especially now that we've seen on the federal level how they are scooping up all of this different data from all these different sources and weaponizing it to identify immigrants and other
right.
communities that they're targeting for attack, right? And I think that so for us, it has really raised alarms across states about
Yeah.
data protected, right? And so we've already seen the weakening of HIPAA protected data. So
Yep.
this is already stuff that should be protected, right? Your personal health data.
Yep.
We're not even talking. I mean, it's like the Wild West out there in terms of consumer health data, in terms of your
Yep.
data, your search histories and the geofencing that's happening when you're on the internet. There are so few guardrails and
Yeah.
regulations about how that data is collected, how it's who it's sold to, and who has access to that. And I think there are some good examples of states like Washington has
Mm,
a My Health My Data Act
mm,
held up as a gold standard that does bring in more of the work around consumer health data, around geofencing. California is doing some work around that too, and some bills are being introduced in other states. And so I think for I think across the board, this has been something that has come up. States are like, let's think about ways that we might
yeah.
try to we can start to put some protections around this, right? So that
Yeah.
it can't be weaponized for providers, for patients, and for people who are helping people access care, right? The helpers too. So
Right.
so
Right.
I think this is definitely an area that we've been really digging into, and hoping to get some make progress moving.
That's really good. And I saw that a question actually came in specifically about this from Lauren, who said, how worried should women be about their data and privacy, and is there a way to safeguard it? And so I'm glad to hear that you all are working on it. I think what's so tricky is like we can sort of put out best practices, right? And you can tell people on that individual level, like, use Signal or do this or do that. But at the end of the day, like, it really is going to require a much bigger and broader, like, change from the top, right? Like, this is not, it sort of reminds me of like when they tell you, like, oh, like, don't use plastic straws, but really it's like 99% of like the pollution is coming from these like billion-dollar companies. So, like, what's the connection there? Is there anything, I guess, individuals could be thinking about, even if it's not changing the way that they sort of interact with their own online data? Is there anything that they should be pushing their state leaders for when it comes to protecting privacy?
Yeah, I mean, I think one, there are things that you can be doing as an individual, right? And there are sort of like websites that are out there that that tell you like this is how you can protect your own health data, right? And I think
Yeah.
those precautions we should all be doing. I mean, I need to clean
Yeah.
that, right? Um,
Same.
so, so I need
Very
to do
much same.
that. Like we can all take those steps. But you're right. It's like sort of putting your finger in like in the just to stop a leak
Yeah.
have like this whole like the whole system is set up in a way that isn't conducive to that, and I think that's why sort of thinking about like how being able to sort of say that data can't be shared unless that unless you actively consent to it, a
Mm,
thing for it, letting people know, so there's not this default kind of sharing, saying who you get to send that information to is really important.
yeah.
Working with like the makers of electronic health records, and
Mm,
sort of saying like there are certain health data, reproductive health, other health data as well, that ought that shouldn't be shared, right? That should be actually walled off, and it should be up to the patient to decide whether or not they're going to disclose it to another provider. So I think that there are a
yeah.
number of different sort of steps that we can be doing, but a part of it is just like is making sure that it's not happening automatically, that there is there is
Right.
consent that's happening, and that we are making it really clear about who's able to collect that data, and how they people are monetizing that, right?
Mm,
And so
hmm.
you can't do that, right? That this data, sort of saying like what you deciding how you can and can't use that data, how you can and can't sell that data, I think is also really important for us.
Yeah. Yeah,
So
and no, just the information and education around it, that like people are aware. Colleen in the chat has a very good point. They said they use CPCs use these HIPAA certificates, which does not mean HIPAA compliant, or something on their websites to dupe people into sort of like get around the law, it seems, right? So that they're not saying, it's like it's a way of like using a particular kind of language to get around state law around calling yourself HIPAA compliant by saying like, oh, you have a HIPAA certificate. And I've seen this myself where they'll sometimes put up, if you want to bring a HIPAA complaint, here's like the website that you would use, giving the impression that you can make a HIPAA complaint against them, but really they're just showing you the website, and it's so incredibly sneaky.
yeah,
Um, it's just absurd, which actually makes, speaking of sneakiness, I wanted to make sure to talk to you about these latest Trump initiatives around encouraging women to have more children and stay in the home. I don't know if you've seen these New York Times pieces by Caroline Kitchener. They've been like haunting my nightmares for the past couple of weeks. For folks who haven't read these, first there was a piece about how the White House wants to encourage, promote that, they use this sort of language, women to have more babies. Um, really, just like the fascism is very strong, right? Like national medals for motherhood, just really gross, weird stuff. Nothing that would actually help people to have kids more easily, right? Like no subsidized childcare, no paid parental leave. Just we want to increase the birth rate. And then most recently, there was another sort of follow up article about how they want to encourage parents to stay at home when of course what they really mean is they want to encourage women to stay at home, and by encourage they mean force, and one of the ways they're thinking about doing that is by um, cutting federal child care programs and basically putting people in the position of not being able to afford child care, and so they have to stay home. And for the governors that you all are working with, how much are you thinking about, like, the connection with those things, right? Like, the abortion rights and reproductive rights, and also these sorts of, like, pro-natal I call them bro-natalists, which is, like, very cringy and cheesy, but I coined it and I'm sticking with it. This, like, bro-natalist, like, nonsense, like, how are you all thinking about the intersections there, or does that come up at all?
Yeah, I mean, I think that comes up a lot, right? I mean, I think that what I sort of see in a lot of these states, and what like acts like reproductive freedom is like fundamental to, right, is pro family, right? I mean, it's about
Mhm.
being able to make decisions about when you're gonna have children, and whether or not you're in a position to be the best parent you want to be, right, for them, and the the what the Trump administration is pushing out, like, they're making it harder to become a parent and dangerous
Yeah,
to be pregnant, right? With
exactly.
the policies that they're promoting, right? If they were really pro family and they really wanted to have more babies, they wouldn't make they would it would be unconscionable to have like the Black maternal mortality rate that we have in this country, right? You would never cut off and propose to throw off 13 million people from Medicaid, when 1 in 5 women rely on Medicaid as health insurance, right? I mean, you
Mhm.
would like throw off like you wouldn't propose cuts to the SNAP program so that people can get like food to raise their family, right? And be able to.
Yeah.
So like those are just like I think fundamental, and while governors are like I think they're fighting back. There's no way that they're going to be able to offset these potential
Mhm.
these potential cuts. But they are working really hard to be able to try to describe the impact this is going to have on the
Right.
people and their constituents and the folks in their states. And I think they're also thinking about like in addition to the sort of pushing back against these federal threats, they're thinking. I think a lot of them are also thinking about like what are the other supports like that we do
Yeah.
that there's paid medical leave and paid family leave, and then there's subsidized childcare, and like these are all the planks to build a pro-family agenda. About free and or subsidized like school breakfasts and lunch so young people can eat, right? I mean, like
Mhm.
all of those things are what is actually going to support families to be able to to sort of families to thrive, and
Yeah.
that we really need to sort of think about ways of like reclaiming that
Yes.
those are the policies that are pro family, right?
Yes. No, absolutely. We're gonna start to take questions in a second. So anyone who's watching, if you have a question, start like throwing them in the chat. But I did want to just, while folks are sharing anything that they want to ask, just on that and on this, like, we need to be laying claim to being pro family because that's what we are, and this is most certainly not, right? Like, how dare you call yourself pro family while you're like dismantling maternal mortality committees? Just completely and utterly absurd. um it does seem, though, to me, I think what's difficult to watch is, especially with these New York Times articles and them calling themselves pro family, and also just around abortion more generally, is that they are so good with messaging, and they're so deliberate, and they're so um proactive and sneaky with all of this messaging. I'm just wondering, like, what are you seeing on our side? What are you seeing with governors? Is that there's something that they're thinking about? Like, what do you think that we can be doing a better job of, I guess, with just how we talk about this issue? Like, I think I'm just constantly irritated is too strong a word, but like, I wish that our leaders, whether it's governors, state lawmakers, whoever, I just wish that they were better at talking about this issue, right? And really laying claim to that, like, positive pro family piece of it.
Yeah, I mean, I think it's we can all do better in terms of like our messaging and how we're framing,
Mhm.
and and really being able to, I think, frame it like I think put it in a way that this is about, trusting people and knowing that they can
Yeah.
make decisions for themselves, right? And then and just like giving them the support and the tools and the resources in order to be able to do that, right?
Right.
And I think that that's part of it. I mean, it's about sort of like being able to have that sort of fundamental autonomy and decision making
Mhm.
for yourself and for your family and for the communities that you're building. And I think continuing to tie that, right, and making those connections, I think is really important. I think that, I think that more of what they can be doing is and I think that the fight with like Medicaid is an opportunity to do that. The fight that they're doing to
Mm.
people, the Department of Education is another way for them to,
Yeah.
right? Like all of these things are connected, and I think and that helps broaden the scope. Like it's not just about abortion,
Mm.
just about access to contraception. It's like all of these different pieces that are there that is there about supporting families and supporting people to build their lives. And so I think that's and that and the like and that I think that the restrictions that they're putting on are actually taking away all of
Mm.
that for folks. And so
Right.
but I would love to hear from folks about like what they what resonates, right? I think we're struggling a little bit.
Yeah. Yeah. Well, I think what's hard, like what I'm noticing, or what I notice is there's just so much defensiveness and reactiveness from our side. I think the thing like I worry about is that um because I think a lot of the work that we're doing is proactive, is preempt, like, right? Like, but the language doesn't always necessarily reflect that. Where I think we take the bait, and when I say we, I mean like everyone, right? Like we're all guilty of it. Like we take the bait when they're like talking about post-birth abortion. We let them sort of frame the debate and drive the conversation so that we're constantly sort of being like, no, like that's not murder. We're not, when we have people on our side, like we have voters on our side, we have an opportunity to just absolutely be framing the conversation in a way that I think that we're not necessarily. And also, I wrote about this last week, the week before. I know that like your governors can't do this. I just want people to be calling them murderers. Like you're killing people. You're killing people. Like you see the maternal mortality rate going up. You see the infant mortality rate going up. We know what the consequences of these laws are. They have been calling us killers for years. They have been using this like really, really strong, incorrect language for years. And I think that we've had this desire to remain like we're not going to enter the fray in that way, and we're going to remain sort of here. And I think we're at the point where we just need to get sort of a little bit in the mud, but that's also just me. um, we have, let's see, Rachel says, remember in the 90s and 2000s when small bands had street teams? It was young people who volunteered, posted flyers and stickers promoting a band. We need grassroots action where we can get info to these women. Yeah, absolutely. I think that we do have, like, there are definitely some pro-choice organizations and groups that are out there like posting stuff on billboards and posting QR codes, right? Christina knows I'm obsessed with advanced provision and like getting abortion medication into as many hands as possible. And I think like things like that are just great, and would love to see more sort of any sort of posters, stickers. We're talking at the abortion everyday team is talking about like, do we do a zine at some point, right? Like we need like some old school stuff, like nothing at all wrong with that. um while people ask some questions, I wanted to get back to, because there was a question earlier um about California and the prescription pill bottles, and then can you explain to people sort of what's going on, not even necessarily just in California, but like what is going on with those efforts to get abortion providers' names off of prescription labels, and why that's so important, and maybe where things, if you know where things stand in California.
I well, I mean, I think that it's under active, like I think it's actively sort of being discussed, and like and I think they
Got
should
it.
trying to move it in California. Um,
Yeah.
Here is that, and I don't know if this is like, I think this is one. I think what we saw with the, with the case in Texas and in Louisiana against Dr. Carpenter was like how was she identified, right? And I think that one of the things that was pointing to was that her name was on the as a prescriber on the medication, and so.
Hmm.
So part of that was like, okay, well, is there a way for us then to be able to protect that identity for providers, so that that doesn't happen? And so, in New York, I think there you can opt to put the
Right.
practice name on. You still need to
Yes.
know
Yes.
prescribing, right? I mean, just from a,
Right.
but it makes it less. It makes it a little bit more protection for folks. And so that's what's now being discussed in California and in other states. So that there's an added layer of protection, that it's not just pointing to one and then like allowing, I think, or directing these attacks to an individual. And
Right.
so that I think is what is at play there.
Right. And I think it's also like not just important for those civil suits or like potential criminal charges, but also just for safety and harassment, right? Like I know like anyone who's watching this knows that the levels of harassment, like the threats, death threats, all of that sort of stuff has just been on a massive increase since Dobbs. Um, I know providers are really worried about it, clinic staff, patients. It is something that is
Totally.
getting really scary, and it doesn't feel, and the administration has made clear that they have zero interest in protecting providers and protecting clinics and protecting patients. I think the thing that they said was they will only enforce the FACE Act if, someone dies, essentially. Like maybe if someone gets killed, they'll do something about it. But they do plan to use the FACE Act to go after pro-choice activists for
Right.
like graffiti on crisis pregnancy centers or something. Um, what's just to we can I know we're gonna be like running over time. We can start to wrap up, but what are folks doing on a state level in terms of that sort of like protection, right? That we can help support or that maybe folks don't know about, like w- given that the sort of federal protections are out the window, they're not going to enforce that. What's happening on a state level to make sure that the clinics
Yeah.
are protected?
It's a great question because I think he's really emboldened, anti
Yeah.
extremists, right? Like he pardoned 20
Yeah.
that were convicted of a federal crime, right, for
Yep.
obstructing and harass, and blocking the entrance to a health clinic, and so and commit violence, and so and then sort of saying like we're not going to enforce the Federal FACE Act, right? So go ahead
Yeah.
want to, I think has made, we've already seen an uptick in threats and
Yeah.
obstruction and invasions, like literally people like storming into those things, assaults on
Yep.
staff, and so I think that there are a number of states that have sort of a state corollary of the Federal FACE Act. Um,
Hmm.
Other states are considering something like that. States have all kinds of different sort of like mechanisms. They have buffer zones. They have like they to sort of like create a
Yeah.
safe to come through. There's a lot of different sort of like tactics that states have put together, and localities
Yeah.
as well. And so I think everyone is kind of looking to see is there about what they might be able to do to strengthen that makes sense.
Right.
There's also teaming up, I think, with local law enforcement and the attorney general's office to be able to.
Yeah.
You can still bring civil charges up again on the FACE Act,
Mm.
even if they're not going to prosecute that criminally on the federal.
Okay.
So these are still tools that are in place, and we
Right.
with external partners who have been doing a lot of thinking around this. To be able to bring some of those like resources and those options to be able to present to governors
Right.
about what they can consider. I was
Right.
thought like as we were talking and about like how do we
Mm.
reclaim this narrative. I mean, the other thing I think I didn't say, but I think is so
Yeah.
powerful is the fact that is for and I am so like floored by the courage of people who share their stories, and offer that counterpoint, and to be able to sort of like to normalize this experience, right? Like 1 in 3 people
Yep. Yep.
abortion in their lifetimes, that or 1 in 4, sorry, because it's gone down.
Yeah.
Thanks,
Yeah,
birth
it
control.
used to be 1 and 3, that's right,
Right?
yeah.
1 and 3, now it's 1 and 4, so thanks, birth control, and but we all know somebody who, or we love somebody, or we care about somebody who's had an abortion, and sometimes, like, it's under, like, heartbreaking circumstances, and
Mhm.
just because they're not ready, it's not the right time for them, or for them to
Yeah,
to bring in another, have another baby. So I think
yeah,
I think that part of that, and normalizing, and like like having people see like how complex the circumstances are around
yeah,
anybody's decision, and just sort of saying like I can't judge that, right? It's not up to
yeah.
certainly not up to a politician. It's really something for that's up to the individual, up to their family and their community,
Mhm.
their doctor or their provider, up to
Yeah,
and to their faith. I mean, I think it's like those are all the factors that actually should be coming into that. And maybe, in the same way that you start to normalize it and destigmatize it, because that's part of it too, right?
yeah,
I think is creating sort of more understanding, and hopefully some more just awareness and understanding, and um, compassion and empathy for like why people are doing this, and why this is something that should be available to anybody, no matter who they are or where they live.
right. No, I think that's such a important and good point because it's not something even now, even on our side, it's not something that's normalized. It is, most politicians, when you hear them talk about abortion, it's still the most tragic circumstances that they're talking about, which of course are really important stories and deserve to be told and discussed and shared. But the vast majority of people who have abortions have an abortion because they don't want to be pregnant. And that's
Right.
just fine. Like there's nothing right. And I think a lot about the speech that then Vice President Harris gave about the death of Amber Nicole Thurman, and it was such a powerful speech because she just like made so clear in her remarks that this was just it was not what she had in store for her life, right? She had a plan. I think the line that she kept repeating was like she had a plan for her life and it was her plan, and she was doing this and she was doing that and she planned to do this, and then she got pregnant. It wasn't in her plan, and so she had an abortion. And that to me was really like revolutionary is not like too strong of a word, I think, because it is not something that you hear politicians talk about or discuss in that way. And I think even just doing something as simple as that and like telling, a non tragic abortion story um, can make all the difference.
Yeah.
I feel like we have gone over, and I don't want to take up too much of your time. I know that we are all crazy busy doing this work and you're doing a lot of it. Before I let you go, is there anything, I'll obviously send out all of your information to the newsletter when we post the video, and I'll let folks know where to find you. But is there anything that folks should keep an eye out for? Any like big initiatives or things that you all are working on that folks should be paying attention to or support or help with?
I mean, I think you're going to be seeing, we're coming to the end of legislative sessions. And so, I mean, there is like a steady drumbeat, I think, of governors and leaders stepping up. We just
Mm,
saw Colorado just signed a whole package of bills. New York
yeah,
just their budget that includes a lot of support for reproductive health providers and patients. So, I mean, I think that I encourage people to sort of see that. I think that that those are these packages that are coming out. A lot of our work really is like is behind the scenes and quiet and in preparation, so that we can come out like that we're collaborating and coordinating, so that we can look around the corner and anticipate those threats, and make sure that we've got our sort of like we're prepared with those plans. Um,
yeah,
a lot of them I'm not, I'm not trying to be evasive. I just like I think that I think that it's just letting folks know that this has been something that governors have not taken their eye off the ball,
yeah,
and I think remain really committed, because they realize that it's not just serving the people in their states, but it's serving people from across the country, as we've seen with these surge states in particular. So um,
yeah,
I think just also, we started off saying this earlier
mm,
before folks joined, was that I am, we have not seen. I mean, the administration has gone after with such a vengeance, right, on
mm,
immigrants,
yeah,
trans folks, on DEI, on like breaking the federal government. But we have not seen the same kind of ferocity yet on
Yeah.
reproductive. They've done a lot of terrible things, right? We ran
Right.
them. Um, but I think they see there is that like voters do not, do not want more restrictions. They
Yep.
want more control over their bodies and their decisions, and this is not a winning issue for them. And so I think we need to continue to reinforce that belief, so
Yeah.
they stay off of off of this issue, right? And to the extent that we can kind of continue to remind them that
Yeah.
not a winning issue. This is not what, I mean, like, and we've seen it time and time again at the ballot box, and being able to push back. And I think it's so important for people to raise their voice and let them know that this is something that we're watching. We're going to hold people accountable for,
Yeah.
and continue to like keep the pressure so that they do back off and they see that that we know that we are paying attention, and we are working on making sure that we're going to try to protect reproductive freedoms, and fundamental
Yeah.
freedoms, regardless of what they throw at us.
I love that. I feel like that's the perfect note to end on. Thank you so much for joining and for chatting. I hope we can do it again. You should come back in a few months and we'll we'll catch up and see what else is happening.
Yeah.
I'm sure it'll be something. And thanks to everyone who joined. If you're not watching live and you're watching this later, all of the information about the Reproductive Freedom Alliance will be there, and you should click through and learn more. And just thanks to everyone for being here, especially you, Christina. I really appreciate it.
Thank you so much, Jessica, for all that you're doing every single day. It's like exhausting,
Thank
and
you.
doing such a huge service for all of us. And so, and thank you everybody for tuning in. I know everyone is really busy, and for you to take the time out to hear what's going on, in Access States and what we're trying to do. We're so grateful for your support.
Absolutely. Okay. Good night, everyone.
Good night, everybody.